When are you?
So much for being with us. 5 minutes to 8 a.m. We kick off our Kickstarter conversation, strengthening healthcare financing for sustainable services, and the big question of how equitable is the healthcare financing in Uganda. To join me for these conversations, I do have Kenneth Mwehonge, the Executive Director, Health Promotions and Social Development. Welcome to Morning at NTV, Kenneth.
Thank you, Priscilla.
So before we get into the preamble of this conversation, I want to find out from you what particularly interested you in focusing on health financing and promoting of health.
Thank you. It's a long personal story. I think first was in primary. My very first elective position was a health prefect. And I contested in primary school, Kevande Model Primary School, and for 3 years I was a health prefect. And then later I lost a sister due to HIV, and it was a very, very painful death, and that interested me more to work harder to ensure that no one dies of any disease. How I wish we all die of old age and not disease. And that's my inspiration for the work I do every day.
Okay. These two platforms did open Kenneth's eyes to the realities on ground with the healthcare system. And the health financing remains ever critical for the realization of universal health coverage and health-related sustainable Goal 3 and Goal 3 of Agenda 2063 on ensuring healthy lives and promoting the well-being of all at all ages, where he comes from to say that how he desires that everyone actually dies of old age. Now, the government of Uganda committed over the years to improving primary health care, but this very same government has failed to fulfill the Maputo Declaration, which requires governments to invest at least 15% of their national budget to the healthcare. And this was at an African Union summit some years ago. Now, to expound more on this, we need to first have the background of what is health financing, Kenneth.
Thank you. So, in simple terms, health financing is how we use our financial resources to meet the health needs of any population. And in that, I mean, it's the foundation for any healthcare system. It's one of the 6 building blocks of the WHO, the core components of a health system. And like I say, it's a foundational component. Without it, you won't have any health system. So that's health financing for you.
Okay, you've said core components of a healthy system, financing being one of them. What are the other 5?
So the other 5 is one is leadership and government and governance. Sorry, and in that they are provide guidance, and that's through our mother ministry, where governance is about the policies, the guidance on how we deliver these services, and that's one of them. Then the other is around infrastructure. We definitely need the health facilities, we need labs, and we need theaters, and that's the infrastructure for delivery, the other building block, sorry. And then the other is around human resources. We need the health workers, all different cadres, doctors, nurses, psychiatrists, and name all of them, lab technologists. So that's the third one. And the fourth one is around commodities and medicines. And these also take a bulk of the healthcare budget, because without them, then you won't access the healthcare. And then the financing is the other, and then the health information systems.
Okay.
Because we need to constantly track or get program data on the diseases, on the treatment, on the dispensing, and that helps us program and offer better services.
We are in an era of rationalization of everything. Cut down on this, cut down on the human resource, or cut down on the medicine expenses, purchase expenses, or expenditures in the healthcare system more particularly, so as to maybe go through the economic crisis that we all know is happening right now. So how crucial is health financing at such a time as this of rationalization, and how can we actually have it sustained?
Of course, we can never have enough resources. We'll always have a deficit, but prioritization of some of the very critical services is very, very important. And as health, for starters, it's a human right. And unfortunately for Uganda, we have no express provision for the right to health in our constitution. And maybe that speaks to why we've stagnated in terms of the budget percentage increase for health. And I think for Uganda, we've never met the global standard, the metrics they use in allocation. If you have a quality care, a service of care, we're behind all those metrics. There is, for example, the Abuja Declaration of the allocation of 15%. We've not come close to that. For the last 10 years, we've stagnated between...
Because I know in the current financial year, the budget for education and health combined gives you the 15%. Yeah.
So it's a shame that such critical sectors have, you combine them to get what the global standard is, and for low-income countries, but also the per capita expenditure for low-income countries recommended by WHO is about 34%, but we are in between 11 and 15%. So that tells you, and that's the most difficult conundrum as the health sector financing that we face. We're putting in less but expect miracles. So there is no shortcut when it comes to financing, and it's demonstrated everywhere. There is empirical evidence to it, and we see how it's affecting us, and we have no other way other than to increase the budget.
Right. I've seen some, groups that have gone out of their way to actually invest in health financing. One of the institutions of health that they have invested in is heart and cancer, but more familiar to me is cancer, and how they've been able to then set up cancer wards to different hospitals in different regions of the country, because one of the challenges that the Cancer Institute of Mulago was facing is the fact that people have to travel leaps and bounds, jump over rivers and valleys to be able to come to Kampala, to the National Referral Hospital, get diagnosis and treatment. And by the time that decision is made and movement therefore followed by, it's a bit too late for some of these Ugandans. They end up losing their lives, something which would have been sorted out should there have been the health financing that you're talking about. You have mentioned priority to health services. And from your experience, could you inform us what should be our priorities right now for the health services that are being offered to Ugandans?
So thank you. So one of the priorities, it's in prevention. And I love the fact that the president subscribes to prevention, and about 70% of the diseases that we are struggling with are preventable. So if we had investment in prevention, health promotion, even the cancers that we're talking about, we can prevent them if we provide enough information, and people are practically involved in health promotion activities, exercising, a good diet, and that alone can help us prevent also the hygiene, washing and having clean environments. That alone can help us avert 70% of the diseases that we have. But also investment in now the Global Health Security Agenda, which is about strengthening our surveillance systems to prevent infectious diseases. Over the last about 5 years, we've seen an increase in zoonotic diseases, and these are basically diseases that come from animals, and our interaction with animals has increased. So also investing in that surveillance, and that's why we're struggling with diseases like Ebola, but also the COVID-19, and those are diseases from wildlife, and we need to invest more in prevention and to avert those diseases.
Okay.
Yeah.
All right, let's transition into universal health coverage. I know that while we're having this conversation, we have to consider, one, the population that is presently in Uganda, the readily available health services that are there, and we also have to consider, are Ugandans able to pick out of their pocket to pay for the available health services? So with that background, the universal health coverage, how does that look like, and when it comes down to Uganda specifically?
So the universal health coverage, I think that's the focus globally, to ensure that everyone accesses healthcare without any financial hardships. So that's basically universal health coverage, or what many term as avoiding catastrophic health expenditure, where you have to sell your property to access healthcare. So universal health coverage is meant to prevent that, so that healthcare is accessible without any financial difficulties. You talked of cancer, where people have to incur other related costs, actually, transport, but also accommodation. So that's not access, because we define access by the 4 A's, and that's availability, affordability, accessibility, and acceptability. And for universal health coverage, all those A's have to be fulfilled. And what's more important around universal health coverage is the financial burden. And you've talked of the out-of-pocket expenditures currently at about 40%, where the health needs of Ugandans are met through out-of-pocket expenditures. And we see also the private sector in Uganda, where there are high charges of accessing healthcare. We saw that during COVID, where on average one had to part with about 2 to 3 million daily for those that needed intensive care services. And could afford out of their pocket. Could afford, exactly. Yes. So universal health coverage is ideally supposed to protect us from that, where access to health care is affordable for everyone. And ideally it's made through the public financing. So it's about governments funding the healthcare sector to ensure that everyone is accessing healthcare without any financial hardships. Well, you have mentioned COVID-19, and you remind me of some institutes that were considerate and lenient enough. For example, NSSF coming up with a healthcare cover that could allow its subscribers to get coverage for those that had COVID-19 specifically. And I thought that was really a goodwill and good out of the heart for the season that we were going through because of COVID-19. But then again, it ought to have been an eye-opener to other institutes and also to government by and large to be able to take the same road in consideration of the kind of population that we have, because it's classified. You have the rich who also cry, and you also have the poor who also die. And how do you bring to balance giving them an equitable healthcare system with the universal coverage, and how is health financing crucial in enabling that? So, the population you're talking about that was benefiting from the initiative by NSSF, and that's about a population of about 20%. That's in the formal sector. 80% is the informal sector, and the most vulnerable. And that justifies the need for more investment by the public sector, by our government, to make sure that they are covered. We need initiatives like the National Health Insurance Scheme. It's a shame that Uganda, we are lagging behind in the region. we are the only ones, I think, with South Sudan who have no health insurance schemes, and these are the schemes that cover such populations equitably, where those that earn more.
Are you referring to health insurance schemes or a national health insurance scheme?
Absolutely, okay. National health insurance scheme, and it's one of the best ways to ensure equitable meeting of the financial needs for health services for everyone.
What would we need to actually have a national health insurance system? Because I know one of the candidates in the previous elections was actually greatly advocating for that in his manifestos, saying that if you cater to the health of Ugandans, you would have catered to the wealth of Uganda as a nation.
Absolutely, and I think that candidate was speaking to the needs of Ugandans. The last two build up to elections, we've had the Afrobarometer surveys that have pointed out health as the most desired priority for the population. So that they are speaking to the needs of the population. And back to the national health insurance conversation, one, we need the law. We have an act that our parliament passed, but when it was sent to our president for assenting, he didn't assent to it and sent it back for further review. And I think that's where we face a challenge in having a national health insurance scheme. But once we have it, then it provides guidance on how to finance the health sector and ensure that employers are offering health insurance for their employees, but also equitably those that are not in the formal sector also having a scheme that covers them.
Okay, so how will the universal health coverage right now help reduce the burden, help reduce the out-of-pocket expenditure for Ugandans? Because right now the out-of-pocket expenditure is standing at 41%. That's an alarming percentage.
Yeah, so like I said, universal health coverage is about financing of the health sector. And again, we've seen stagnation in the percentage allocation. In nominal terms, in terms of the amount that is allocated to health, we've seen growth, definitely. And that is because of the growing economy. But in terms of percentage terms, we've never come close to that 15%. For universal health coverage to really work, we have to first meet like those global metrics that that are in place in ensuring that we have enough financing for the health sector. So universal health coverage it's basically about financing and meeting the budget deficits. We have a health sector strategic plan, but again, through projections, again, it has a financing gap. So it's ensuring that we prioritize health and financially, and we should stop being rhetoric, putting these things on paper, but not implementing them. I think we need to walk the talk.
Okay. Government is not walking the talk because, in all honesty, COVID-19 was a wake-up call, especially for African governments, in how important the health sector is to the entire embodiment and structuring of a country in governance and democracy. So you would have thought that COVID-19 coming, the pandemic, how we faced and how we were challenged with it, and how we couldn't get immediate access to vaccines that were readily available in the market, and how we then had to get into, last-minute purchases for beds and other support facilities and equipment to be able to help those that were in the tough stages of COVID-19. This all should have opened our government's eyes to the necessity of improving on our healthcare system, which all comes down to how much they finance the present budget. But unfortunately for us, the financial year, which was 2021 into 2022, then there was honestly no change within the present financial year that we are in. And so does that speak into government's eyes not yet open to the realization that health should be a priority?
I totally agree with you. And I think COVID was the loudest alarm bell that we've had for decades in terms of exposing the weaknesses within our healthcare system, and more to do with financing. Talk of the infrastructure, talk of the supplies, talk of the HR. I think COVID exposed all that. And to me, as an advocate, as someone who promotes health, it was like a blessing in disguise, because we had everyone talking about the health sector, the importance of investment in the health sector, and we thought this is the time now to go back to the drawing board and reflect deeply and then prioritize health. But it's a shame that that didn't happen, and it's business as usual. And I think yesterday I saw the Minister of Health recommending shortening of the terms for schools due to another epidemic that's looming on the horizon. And that speaks to the more need to invest in the health sector. I saw people pushing back, but remember, Ebola has a fatality rate of close to 70%, it's about 69%, which is really, really high compared to COVID, which globally was between 1 to 2%, varying in some places, others 5%. And here we're talking of an epidemic that has that high fatality rate. And so there is need for investment in health. And I wonder even our members of parliament, what they think when they step on the floor of parliament. You meet with them on a one-on-one, outside parliament, everyone agrees with you. But when it gets to parliament, then it's a different story. Yeah, so I really, really hope that we pick lessons from COVID. Also now with this epidemic, Ebola. And you know, if it's a pandemic, because pandemics are global, it's a global crisis. An epidemic, it's more in a specific area. And when we have epidemics, then it should be eye-openers for us to prioritize our national agenda, because we can be cordoned off by the rest of the region and the rest of the world, and you know how that can impact.
I mean,
on
we've
our
already
economy.
started seeing it. Those that are traveling from Uganda are suffering for it. In the USA, they're being diverted to other airports because of the screening of Ebola, seeing that happening in the UK right now. And so travelers, Ugandan travelers to the rest of the world, you know, there's lots of question mark and health concerns for them moving into those other countries. Now, the reality of the matter seems to be that we did not learn anything from HIV, the scourge. Here in Uganda, COVID-19 has taught Africa nothing, particularly Uganda, but more so the small, you call it small, but so I mean, people are dying at a very high rate right now, and that's the Ebola. And therefore, it seems that nothing is triggering the government's attention to the health sector. In your opinion, what then could trigger the government's attention to the sector?
I hate to say this, but it's disasters that wake us up. And again, unfortunately, it's we forget too easily, and they say Africans learn through experience, which is a shame. And I think if this crisis, the Ebola crisis, goes out of hand, I think I really hope that should be our turning point. But even now, I think it's not yet too late to prioritize our health sector, and I think, to me, it's given, because it's very evident that we have a very, very big crisis looming on the horizon. We have a private sector that's charges very outrageous prices, and that's due to lack of regulation. And through COVID, actually, we learned that there is no scientific modeling on determining of these prices by the private sector, and there's a lot of profiteering there, and that we need to have a conversation on how the private sector can contribute without charging outrageous prices. And I think the health insurance scheme, I think that can help also change the landscape of financing in the health sector.
Okay, looking at the mortality rate here, especially when it comes to maternal and neonatal deaths, it's alarming. It seems to be increasing by the year from 2013, 2014, 1.75%. Then you have it increasing 1.78. Then you have a reduction of it in 2015 to 1.55%. But then in the most recent years, between 2019 and presently, that percentage is going up. And neonatal deaths, I've had, allow me to call it, the privilege of experiencing neonatal healthcare systems here in Uganda. And again, it comes down to, if you cannot afford it, then chances of survival are close to none. So in that regard, how can health financing actually help a long way in reduction of this maternal and neonatal deaths in the country presently?
You know what, it's very, very interesting when you look at the causes of maternal mortality in Uganda. Now one of them is hemorrhage, that's bleeding for the women that are delivering. But look at our blood bank here. The financing, they've always cried, also going for the soft targets or the low-lying fruits. We base more on congregate settings, and schools are the biggest contributors of our blood, and we've not explored the other options, and we struggled. I also had hoped that during COVID we would learn that we cannot fully rely on such. It was living dangerously, and then look at the other cause, which is preeclampsia, high blood pressure among women, and what helps treat that? It is magnesium sulfate, but look at the stock availabilities of magnesium sulfate in the public sector, which have been as low as 36%. So there are simple things we could do that could prevent these maternal mortality, the neonatals, the oxygen, and this was also exposed during COVID. So
exactly, because actually it happened to me during COVID. In a private setting, that amount was over 3 million shillings. In so-called government setting, that amount was about 400 to 600,000. However, the condition was, and this was from the medics within the system of the public sector of health, and they were telling us that if you want survival for your child, you will have to consider the private sector, because attention here is minimal. Unless you're willing to pay into kidogo to one particular last, to pay constant attention to your child, if things happen, don't blame. I was like, wow.
Yeah,
very alarming.
Yeah, it is. So, and it's a classic example of what's going on and everywhere. And this, it's preventable. I think to me, it beats my mind why some as simple things as that we don't do and don't prioritize. But I think we must wake up. The other thing we need to demand is the express provision of the right to health in Uganda. I think there then our government will be fully responsible in ensuring that all health needs are met, and I think that's why there is early way and they get away with some of these things.
Kenneth, this brings to task a question. In your capacity of health promotion and social development, while we await on government to wake up, we cannot be seeing people dying because of some of these situations. So in your capacity, what are you doing to be able to avert or revert some of these situations?
Yeah, I will start with preeclampsia. I think for the last 5 years, we've deliberately worked to increase awareness around preeclampsia. It's a condition that has claimed many lives, but that's avoidable. And then also supporting initiatives like blood donation drives, health promotion activities, fundraising activities to complement our government, and also ensuring that we have inclusive policies that ensure that everyone in Uganda is accessing healthcare services, these budget advocacy. We are in these budget conferences as low as district level, ensuring that we are pushing for the prioritization of healthcare. So there are several things that we are supporting with, but also supporting with the delivery of some of these services.
Okay,
yeah.
All right. Away from that, does the health financing consolidate a country's preparedness to combat such emergencies?
That's a good question. I think we still have we can do better. We still have a long way to go. I think in the region we have one of the best pandemic response systems, but also they've been majorly biased towards the borders, especially our borders with Congo. Yet we need like a national-wide response or building of systems. I'm very sure if the outbreak in Mwehonge had been along our borders, it would have been detected earlier and mitigated, because there's been very heavy investment in those areas, but we now not realize that we need a more national and all geographic intervention, and that comes with resources. Other than having siloed interventions in certain geographic areas, there are some things like pandemic preparedness that need more comprehensive interventions.
Okay. All right. So if health financing is so crucial, why do you think that this government has failed to prioritize the health sector? And then in the financial year 2021-2022, the budget was 2.7 trillion, but it has reduced to 2.5 in the current financial year that we are in. And I mean, today's Ebola, it did not come planned, but if today's Ebola, what's going to come next? And yet we don't seem to see that readiness to handle these emergencies.
Yeah, I think it dates back to how health was viewed early on. It used to be viewed as a consumptive sector where you're just pumping in money and you're getting nothing. But that conversation has changed now. We see health is wealth, and it's an investment. If you need a productive community, then you have to invest in health. And I think that explains why it was neglected for very many years. Also, some programs that came in, like those structural adjustment programs, were still suffering the effect of them, that promoted privatization and the shift away from government playing some critical role in offering of these services, and that explains why we're struggling. But also we have competing priorities. We need the infrastructure, we need the education, we need the agriculture, we need to invest in these others, but there needs to be a balance, because we see health is cross-cutting across all these other sectors, and we need to prioritize it. Also, there is the issue of debt. We've not talked about our debt growing. I saw even yesterday they're requesting for another loan, which is growing, and it was about 78 trillion debt that we have.
1.7 trillion.
Yeah, yesterday is 1.7 that they're asking for, but already we have a debt of 78 trillion. So that also explains, because much of our income then goes to paying debts. So we are left with very little to invest into
the different other sectors. So if we have little to invest in, and in conclusion, how best can we, what recommendations would you then offer government to embark on right now to ensure that there's health financing that can continue the system effectively?
Yeah, so for starters, borrowing is not a bad thing, but what you use the money for is the question. If even what they are borrowing is invested in sectors that will have much more returns, I think that's fine. But for the health sector, and I talked of the difficult conundrum we are in, the more we invest little, the more we don't meet these global metrics that have been set, the more difficult and complicated it becomes. So to sort it, I think the initial investment might be high, but once we have this initial high investment, then there are dividends, there are returns that we get, and in the end, that cost again goes down, and we also see it in productivity of citizens. We have very high new infections of HIV that we are having, these maternal deaths. We are losing many more, but also investing in upstream investment in population growth. We have one of the highest population growth rates in the world. So also stopping that or closing that tap and having a manageable population. So those are some of the things that we should prioritize and invest in, and in the end, it then balances up and adds up to what would ideally want to invest in other sectors. Okay,
and conclusively, what would be the benefits if there was focus on health financing in Uganda?
So one of the benefits, I think, is that we would move away from focusing on the curative. That's the 70% of the diseases we face can be averted through prevention. So if we invested, we would avert those, and then we would be moving away from what now super specialized. And the more you move to super specialized services, it shows a gap that there's something you're not doing right in terms of preventing. So we would be moving away from that and then saving more and investing less and saving more.
All right, thank you so much, Kenneth. And in your health promotion and consideration of social development, very enlightful conversation there. And it comes down to the fact that if there's health financing, then you're going to be ensuring there's availability, affordability, and then also accessibility, and what we need to have on the market, what Ugandans need to be enjoying, is good health services that people can afford out of their pockets at any given time. This brings us to the close of our Kickstarter conversation. We do have Stephen Bite that is on ground. He's going to be talking to the State Minister for Foreign Affairs, and that is Oriem Henry, in reference to what's happening in the DRC Congo. Of course, recent emergency of fighting M23 has appeared. It has brought conflict between RDC and Rwanda. Remember, all these are members of the East African community, and more so, most recent statement that got things haywire was when you did have the expulsion of the ambassador of Rwanda to Congo being sent back to Rwanda. Now that was a statement. Stephen Bite will be giving us enlightenment into this discussion as we return.